Hello students, this is Professor Baldwin. This will be the second recording for topic 6. We're going to take a look at urinary elimination, and this is chapter 46 in the Potter and Perry textbook. In topic 1, we talked about different health promotion models, and one of those was Maslow's hierarchy of needs. The bottom row is the physiological needs for human survival, and elimination is listed in that category. This topic will cover urinary elimination, so all things related to providing nursing care for patients related to urinary elimination. So what's the nurse's role in providing care for a client? Assessment and planning care for those findings in a patient's assessment that are abnormal. Promoting health, preventing illness, so promoting health as far as urinary elimination. Further into the program, you will learn the skill of urinary catheterization, but we can discuss how a nurse will provide care for a client with a urinary catheter, even though you're not learning to do that until later. You won't learn it this semester. We can still discuss how to provide safe, effective care for a client who has alterations in urinary elimination. And one of those would be in the hospital setting, a patient with a urinary catheter. And of course, our overall goal for everything we do for our clients is safety. And we want to make sure to minimize the risk of infection in the urinary tract. The urinary system is a sterile environment, and so we want to make sure anything we do prohibits the introduction of bacteria into that environment. If you need a refresher on the anatomy physiology of the urinary tract and the urinary system, you can look at the beginning section of the chapter in your Potter and Perry textbook, chapter 46. I won't be going over the questions that are shown in the PowerPoint. You do have the answers provided in the speaker's notes. So if you have any questions about these, please notify your instructor. I'm sure they would be glad to help you. Something else to keep in mind is that you do have speaker's notes in each of these slides, and you're responsible for that information. If there is mention of any information in the Potter and Perry textbook to review, such as a box or a table, you'll also be responsible for that material. You could see an exam question on any of the information that's provided in these PowerPoints, and it's suggested to review in the Potter and Perry textbook. So make sure that you go over your speaker's notes well, know that information, and then review any information that it directs you to in the textbook. You have 10 slides in this PowerPoint that follow the case study of a patient with impaired urinary elimination. You can use this to help guide your studies, to think about what you would do in the care of an actual patient using those critical thinking skills. What would you do for this specific patient? Using the nursing process to provide patient-centered care. You can gather the information off these slides and first look at your assessment data, identify those abnormals, those things that are concerning or that would lead you to know that the patient has risk for problems. You have to assess first. That's the first step of the nursing process. Without assessment data, you have nothing on which to base a plan of care for your patient. You have nowhere to begin. I won't read through each of these case study slides, but I'll suggest some things you can look for as you follow along. So on this slide, you can look for new assessment findings, changes to the patient's condition, just the same as you would if you were providing care for a real patient in the hospital. Also, you want to pay attention and be watching for any new orders that are placed for your patient. Again, if you need to refresh your memory on your anatomy, physiology, and pathophysiology of the urinary system, you can use your Potter and Perry textbook, chapter 46. You want to have a good understanding of what occurs during the act of urination, the parts of the urinary tract, what functions they perform, what factors are going to influence an individual's urination or cause any elimination problems. And this slide shows 4 common elimination problems that we're going to look at in a little more detail further into the presentation. In this case study slide, the nurse is thinking about all of her assessment findings for the client. She's using the knowledge that she already has about the urinary system and what is normal, what's abnormal. She's also thinking about previous experiences with other clients and using that information to help her cluster the data and determine what the specific needs for this patient are. Let's look at some common urinary elimination problems and think about situations where you might be providing care for a patient who has these. Urinary retention is when the patient doesn't completely empty the bladder of urine. There can be different causes. It could be a physiological cause. It could be a problem with musculature, especially in women who've had babies and the muscles have relaxed over time in that area where we control the flow of urine. It could also be a problem that arises because the individual is in a situation where they're unable to empty their bladder. They don't have access to a restroom, or as in the case of nurses, often we're so busy taking care of everyone else, we forget or just don't take the time to take care of those things that need done. And so urinary retention, the problem is that when that, even if the patient is able to urinate, urinary retention can occur because the bladder isn't completely emptied and some of that urine stays back in the bladder. And this can lead to a urinary tract infection. These are more common in women because women have shorter urethras, less distance for the bacteria to travel to get into the urinary tract. The abbreviation for this you'll see in here is UTI, urinary tract infection. Also in the hospital setting, often when patients have to be catheterized, they have to have a tube inserted in the urethra because we're collecting the flow of urine for various reasons. But remember that the urinary tract is a sterile system and it has to remain sterile. If bacteria is introduced into the system, then the patient can develop a UTI. And so it's very important as you learn your skills, especially the areas that are sterile and need to remain sterile, that you follow all the procedures the way you've been taught to protect your clients from infection. And then urinary incontinence is also a common urinary elimination problem. And there are different causes of urinary incontinence, but basically it's when the client has leakage of urine unintentionally, for whatever reason. We'll look at some of the urinary incontinence causes in another slide. So our nurse in this slide is continuing to assess the patient. She's thought of additional information that she needs to know. See if you can identify the subjective information in this slide. And then she goes on to think about her previous experiences with other clients and uses that information to help determine what care this client needs. So when preparing to use the nursing process to assess your client and plan care for that individual, you want to think about some of the knowledge that you've gained. You'll gain it through the nursing program, and then you'll gain knowledge after you become a nurse. And you'll store that knowledge away somewhere in your mind. So before we begin looking at this client's situation, we want to think about what we know about the urinary system, potential elimination problems, and we begin with infection control and hygiene because safety is always paramount. It's always our most important concern when providing care for patients. The most important thing, remember, the urinary tract is a sterile system, and so we want to keep the patient safe by making sure that no bacteria is introduced into that system. So think about what you've learned as far as protecting a patient from being infected, protecting that area so that a bacteria doesn't enter the urinary tract. And that would include providing hygiene for the client. You want to make sure that bacteria is not introduced into the urethra when you provide hygiene. Also, growth and development will have an influence in how we provide care. What is our patient's life stage? Where are they as far as growth and development? Is the client able to be continent of urine? Is there some reason in their growth or development or at their life stage that they've developed a problem or have a problem with maintaining urinary continence? And then psychosocial implications. So this could apply with our patients who do have continence issues. We want to think about the psychosocial implications that could have that would affect the patient's holistic care, their body, mind, and spirit. So as we begin the process of assessing and planning care for this patient, we remember that we have to use critical thinking. And to do this, to think critically, we're going to pull in information that we already have, the knowledge we already know about providing care for clients, keeping the urinary system, the elimination process healthy, promoting health, preventing illness. We're going to think about previous experiences. You, at this point, won't have a lot of experience with clients, but that will come over time, and you'll incorporate that knowledge as well. And always critical in our assessment of patients and planning care is gathering information from that patient. Your patient's the best source of information about themselves. So you don't want to forget to gather the important subjective information from the client. And then we're going to consider our critical thinking attitudes in planning our care. And remember the intellectual and professional standards, the standards of practice and professional performance, using the nursing process model to plan appropriate and effective care for each and every client. We want to deliver patient-centered care. Always include your clients and any caregivers in the assessment process. In your PowerPoint slides, when we get to the part where we start talking about the nursing process and the step of assessment, you'll see the expression through the patient's eyes. You'll also see it when we get to the part where we talk about evaluation. And this is a reminder to include the client and any caregivers. Your client is going to be the best source of information about themselves as long as they're able to communicate effectively. So don't forget to get that subjective information. And this slide shows some of that information that the patient can provide that's going to be really important when you're assessing the patient's urinary elimination. Self-care ability. How much is the client able to do for themselves? Of course, remember Dorothea Orum's theory, only do for the patient what they can't do for themselves. If they're able to perform certain skills and abilities, then we let them. If it's altered, we help them. So is your patient able to safely get to the toilet, to participate in urinary elimination? Do they need help with that? Are they able to provide hygiene, appropriate hygiene, or do they need assistance? Ask them about any cultural considerations that we may not be aware of that apply to their specific culture related to hygiene practices, elimination processes, that kind of thing. Health literacy means what do they know about health care, health promotion, illness prevention related to urinary elimination? Does your client know what can contribute to a UTI or other urinary elimination problems? Do they know what to do to help prevent UTIs? And then you want to obtain history from the client. So what is their normal as far as their urination elimination pattern? What's normal for them? Do they possibly work a job that they don't get to take bathroom breaks very often, or maybe they get busy and forget? Is it someone who possibly has frequent trips for urination purposes during the night that could wake them up from sleep and they need to go to the restroom during the night when they should be sleeping? Also, are they having any abnormal symptoms that could indicate that they have alterations in their urinary elimination? You'll also use your objective assessment skills to gather data about your client's urinary elimination status. This is going to include inspection of the external genitalia, so looking for any abnormals. The urethral meatus is the opening of the urethra. And then also the perineal skin, which will be the skin around the urethral meatus and the external genitalia. Also included in the assessment of your client's urinary elimination status is assessment of the urine. If you work in an inpatient type facility, hospital, long-term care, those type of places, you may have an order to monitor your patient's intake and output, and that's often abbreviated I and O. So I for intake and O for output. You'll hear people refer to it as the patient's I's and O's. Intake, any fluid that goes into the patient's body, regardless of how it gets in. And then the output is any fluid that is eliminated from the patient's body. And your urinary elimination is going to be a large amount of that. So your facility will have different items, devices that you can use to collect urine. The one in this picture is like a little hat, and it fits over the toilet bowl. Then you would put the toilet seat over top of it to hold it in place. And when the patient urinates, that little hat is going to collect the urine. You can see the measurements on the side, and in milliliters, you're going to easily be able to look at that and know what the patient's urinary output was for this void. And you would document that in the patient's I's and O's. Remember that a patient's fluid intake should equal fluid output. The best way to measure or assess a patient's fluid volume status is daily weights. You would weigh the patient the same time of day, usually in the morning before they've had anything to eat or drink, with the same scales, same clothing, and that's going to be the best indicator of that patient's fluid volume status. Other details you want to document about the urine are the color. Normal urine is usually a straw-like color to light amber. The more light in color the urine is, the more dilute it is. The darker it is, the more concentrated it is. Also, darker urine could be an indication that the patient needs to drink more water, more fluid. If the patient has any type of bleeding in the urinary tract, that urine could be a pinkish tinged. Also, you'll learn as you go through the program that there are some medications that a patient might take that could color the client's urine so it comes out a different color. And it's not a problem with the patient, it's just that the medication has altered the color of the urine. There's an over-the-counter medication called Peridium that people can get if they feel that they have a UTI. And often when patients take that medicine, it will turn the urine an orange color. Also the clarity, which means, is it clear? The opposite, if it's not clear, would be cloudy. So you can have the urine in a container that you can assess, look through the container. The little specimen jars could be something that could be used. Put a little bit of the urine in there, and then you can look through the transparent jar. Can you see through the urine? Then it's clear. Cloudiness indicates that the patient could have infection, and is always a finding that you would want to report. If it's a new finding, you would want to report that to the provider. And more than likely, they're going to order a urinalysis and urine culture to have that urine assessed to see if it is an indication of infection. And then odor. Normally, urine doesn't have an odor per se. Again, if the client has alterations in elimination, there could be odor. If a patient has a altered elimination process, so an urostomy or other way that the patient voids urine, there could be a change in the smell of the urine. But often, if there's a foul odor, it indicates infection. In this slide, you can see subjective and objective assessment findings that the nurse has obtained. Often in inpatient settings, the nurse is responsible for collecting urinary specimens when the provider places orders. Important to follow the skills procedures that you're taught in the program. You're going to learn more about how to collect these specimens as you go through the program and in your clinical experiences. One of the important things to remember, especially, is when you follow the procedures the way you've been taught, you'll know how to keep from introducing bacteria into the specimens. This is going to be very important. I mentioned in the previous slide that if there's suspicion of infection, you may have an order from the provider to collect a urinalysis and urine culture. So especially in those, important to follow medical asepsis the way you've been taught, to not introduce any bacteria, because then that can alter the results of those tests. This slide shows you a list of potential nursing diagnoses for your clients who have urinary elimination problems. So now we've reached the planning step of the nursing process. We've gathered all the assessment data that's needed and clustered that data, identified the abnormals or the situations that we're concerned could become problematic. We've identified these with nursing diagnoses. So now we're going to set goals and create outcomes. Always include your client and any caregivers in this process. Sometimes the care may be delivered in an inpatient setting, but it could be that the patient will go home with this plan and will implement it themselves. So you want to make sure that it's agreeable to the client and their caregivers, that they will follow it, that they're able to follow the plan. So when you plan, you begin with the end in mind. What are the abnormals, the problems, and what do we want to happen? Where do we want to see the patient after we have implemented our plan of care? What do we want that to be for that patient? So we set a goal, begin with the end in mind. Goals are broad, and goal is just going to give a broad statement about what you want to see happen for the patient. And then we develop outcomes. The outcomes are going to be more specific than the goal. So we start with the goal and fine tune it. We're going to make it more specific. You can use the acronym SMART. S for specific, M measurable, A attainable, R realistic, and T for time frame. So you want to give your plan a time frame. At the end of that time frame, you're going to come back and reevaluate, reassess, and evaluate how your plan affected the client. Was it successful or was it not? So in this step of planning, we set those specific outcomes so that when we reach that end of the time frame and we want to see if our plan worked, we have a baseline that when we evaluate, we can determine what's going on with the client at that time, compare that to the expected outcomes that we set. Did we meet the outcomes that we wanted for this client or that the client wanted for themselves? And either we have, which is great, or sometimes we don't meet those expected outcomes. We'll talk about that when we get to the evaluation slide. And also when we set goals and expected outcomes, we want to remember to prioritize. You always address the most important, most critical, most life-threatening problems first, and then continue to address needs based on order of importance. Remember also that nurses don't work alone. We should never be isolated in caring for patients. We're always going to be part of a team, and consider the different team members and what are your patient's problems, what are their specific needs, and are there certain team members that we can pull in to assist with specific assistance to help in planning care and delivering care for those clients. We want to collaborate with those other team members. So the nurse has determined a diagnosis for her client. And when we determine diagnoses, we give diagnoses for each individual problem. And then we follow through the nursing process for each of those diagnoses, independent of the others. We address one thing at a time in order of importance, prioritizing. And so in developing your plan of care, you want your goals and your outcomes to match what your nursing diagnosis is. And again, we address one problem at a time. So the goal, patient will have normal micturition within 1 month. And micturition means urination. The patient will be able to urinate normally with no complications within 1 month. That's our time frame. When we implement our plan of care for the client, we want to begin by addressing health promotion and illness, disease, injury prevention. So it's much better for the patient and often much easier to teach our patients the information they need to know to stay healthy and stay safe than it is to try to fix them after these problems have developed. Patient education will be a very large part of what you do as a nurse. So in educating a patient to promote normal micturition or urinary elimination, we want to teach them about best habits for elimination, not to ignore the urge. If they can urinate, if they feel the urge, they need to take care of that. They need to make sure that they empty their bladder completely. That might take concentration and specific focus to make sure that they empty their bladder, but it's very important as far as the health of the urinary tract, also in preventing infection. We want to help them know how much fluid they should be drinking daily to maintain normal urinary elimination. And then also providing self-care, hygiene practices, what they can do and not do to prevent bacteria from entering the urinary tract. And this slide shows the interventions that are going to be applied for the client in our case study. Go back and look at some of the problems, some of the assessment findings that were abnormals for this client, and compare it with the interventions that have been planned for the client. The skill of inserting a urinary catheter isn't part of the level 1 skill set, so you won't learn how to insert a urinary catheter until later in the program. And a lot of the information on this slide will be presented then. However, there's some very important information on this slide that you do need to know at this point, and that is how to provide routine catheter care for the purpose of adequate hygiene and preventing catheter-associated infections. Remember that the urinary tract is a sterile system, and we have to make sure that the care we provide doesn't introduce bacteria into that system. When a patient has an indwelling urinary catheter, that tubing is holding open the urethral meatus. So basically, it's providing a portal of entry for infection. So it's very important that the nurse provides routine um, Foley catheter care. Depending on the facility you work at, they will instruct you on the policies and procedures for providing routine catheter care. Very often, you're going to do this at least once a shift when you work in an inpatient setting. And you're going to use the supplies and materials that they provide as they instruct to promote hygiene for patients with indwelling Foley catheters. So you want to also remember what you've learned in your topic 3, the information that you've learned about providing patient hygiene, and in your skills lab, especially hygiene in the perineal area, that you use those skills as you were taught so that you don't introduce bacteria into the urinary tract. This slide shows some alternatives to basic urethral catheterization and also mentions some urinary diversions that you may see with your client. The picture on the right shows a suprapubic catheterization. So you see the catheter tubing. It's going into the area just above the pubis, which is approximately where the bladder is. So it's working to drain the urine out of the bladder, and the urine doesn't proceed through the urethra to the exit. So when we implement care for our clients, there are some things that we can teach our clients with urinary elimination problems that can help with those issues. You may have clients who don't have the best urinary elimination habits, and lifestyle changes can often help those individuals. You may have clients who have gone for a period of time resisting the urge to void when they feel their bladder full. For whatever reason, maybe they feel like they're too busy at work, they just don't take time. Explain the importance of emptying the bladder when it gets full. You could suggest that they set a schedule and follow a schedule of taking those bathroom breaks. You may have clients who are experiencing urinary retention and don't realize that. They feel like when they void that their bladder gets emptied, but there could actually be some urine retained. So you would want to encourage them that after they voided to try to see if there's anything else, if there's any more urine that could be voided. Because if they are retaining urine over time, that could set them up for problems for urinary tract infections. You may have clients who have pelvic floor muscle weakness. This often happens with females who've given birth vaginally, and that can contribute to 2 types of urinary incontinence: stress incontinence and urge incontinence. Stress incontinence is when anything puts stress on that pelvic floor muscle and causes it to relax, and the patient then leaks urine. It could be something as simple as a cough or a sneeze, or if the patient goes up and down steps, jogs, runs, that could cause jarring of that muscle just enough to relax it, and the patient experiences leakage. Urge incontinence occurs when the client, for some reason, feels the urge to void, but they don't have advance warning, and so they feel the urge to go, and they have to go right now, and often don't have time to make it to the restroom before they leak a little bit of urine. Different things can contribute. It could be medication, a physiological situation. It could be the result of going for a period of time where they ignore the urge to void when their bladder gets full. And so performing these pelvic floor muscles exercises can help. A common one is Kegel exercises. Kegel. And to perform those, you teach the patient to tighten that pelvic floor muscle as if they were going to hold their urine to keep from urinating. Um, Contracting that muscle um, can help over time to strengthen that muscle. So you would encourage them to practice those exercises. You may have a client who has a condition where their bladder, um, with not very much urine, not a full bladder, but with any urine in the bladder, they feel like they have to go frequently and they don't void that much. There's not much urine in their bladder. It can be that these clients have problems at night when they're trying to sleep. They keep being woken up to have to use the bathroom. Um, and so bladder retraining, not holding a full bladder of urine, but if the patient feels the sensation that they could use the bathroom, just hold it for a little longer to train that bladder so that they're not so sensitive to that urge whenever there's a small amount of urine in the bladder. Toileting schedules, mentioned that in lifestyle changes, but even during daily routines, it might be that the patient um, forgets to go to the bathroom. They just don't feel that urge. And so informing these clients, educating them on the importance of emptying the bladder appropriately. They can set toileting schedules to remind themselves to make those bathroom breaks. You may have clients with intermittent catheterization. This can be for different reasons, but this is different than an indwelling Foley urinary catheter. For these clients, they have to um, have a catheter tubing to void their bladder of urine. And the tubing doesn't stay in, it's only there temporarily long enough to empty the bladder. What to remember about this situation is if the patient has a full bladder, the bladder is an organ that expands to meet the need of the fluid in it, and then it's going to contract back to a smaller size once it's emptied. When you use intermittent catheterization for a client, you don't want to empty a full bladder all at once because the bladder is a stretchy organ and it will stretch to accommodate. If you empty the contents of a full bladder all at once, that bladder can go into spasms. It's very painful for the patient. So in emptying the bladder, you would want to eliminate um, a small amount, no more than half of the urine in the bladder, and then take a break. Um, Wait. It doesn't have to be a very long period of time, but just give a break and then come back and release the rest of the urine. Also important to remember the importance of skin care for clients who have any type of urinary elimination. You want to make sure that the urine doesn't sit on the skin. It can cause damage and breakdown. So the final step of the nursing process is evaluation. We want to evaluate where the patient is after we have provided the interventions. We want to know were the goals reached? Did we help the patient? Um, Always include the patient and any caregivers because you want their input on the success of our care for the patient. With urinary elimination issues, this patient's self-esteem can be affected, especially in situations where there's incontinence. Um, this could interfere with the patient's self-image. It could cause them not to want to interact socially or have intimate relationships and could cause emotional status issues. So you're going to look at where the patient is now that the plan has been implemented. What's the patient's current conditions? The way we can evaluate to know if the plan was successful is to go back and compare where the patient is now with the outcome expectations that we set before the plan was implemented, the SMART outcome identifications, those expected outcomes that we wanted to see. Remember, the outcomes are specific, measurable, and have a time frame. So when the time frame is up, we evaluate and we look at the patient's current status compared to where we wanted them to be in that expected outcome statement. Measurable. Did the patient meet those expectations that were set? It's great if those expectations are met. Then we can just continue that plan for the patient unless something changes in the future. Sometimes the plan did not meet those goals that we wanted for the patient and the patient wanted for themselves. So then we need to investigate and find out what the reason is that our plan didn't work. Could it be that it wasn't attainable for the patient? The patient wasn't able to follow through with the plan. Once they tried to implement the plan, they were not able to for whatever reason. Maybe it was just something that they weren't wanting to do. Or it could be that they followed the plan exactly, but for some reason, there are times when the plan doesn't help us reach the goal we want. And if that's the case, then we just go back and reassess, work with the patient to determine what the issues were, and then come up with a new, better plan to help the patient reach those goals. So on this slide, you can read through the evaluation process for our case study patient, where the patient is now as far as their current health status, and then go back and look at the expected outcomes and compare. Were the expected outcomes met after care was provided to this client? Some safety guidelines to think about when performing nursing skills for clients with urinary elimination problems. Always, we want to maintain medical asepsis whenever we're working with the urinary system. The urinary tract is a sterile system, and you want to follow the principles and the procedures as you were taught in your skills lab to prevent introducing infection into the client's urinary tract. Depending on the patient's condition, you could have some very seriously ill patients who are unable to fight off infection, and it could be very problematic if they get a UTI. We do have patients who have latex allergies at times. In the past, we've had a lot of equipment and supplies that had latex in them. These days, a lot of that has been eliminated, and the supplies and materials we use are most often latex free, but you still want to be observant and look at your packagings. If you happen to have a patient who has a latex allergy, you want to look for any latex that could be in the supplies you're using. Make sure that you don't use anything that has latex. And another potential allergen for clients is betadine. So you want to make sure you look at your patient's allergies before beginning any skills procedures to see what those allergies are and identify if any of the supplies or materials you're using contain that allergen. And if so, you want to use alternatives that are going to still be as effective. And that concludes this presentation. There'll be 2 more for topic 6, so look for those, and thank you for listening.